Thank you to all of our panelists for spending their time and energy to join us here today for what's sure to be a really great conversation about facilities and COVID. This is our webinar, Keeping Facilities and Maintenance Personnel Safe During COVID-19 with Laura Duckworth, Melanie Peapell, and Ron Souza. We're going to have a quick round the horn here, just introducing our panelists. They can tell us a little bit about themselves, their backgrounds, and a short bit about the scope that they're managing. And then we can get into our questions, after which we'll spend about 30 or so minutes about live Q&A, and really looking forward to hearing your questions and having these conversations. So Laura, would you mind kicking us off here?
Sure. Hi. And if it gets too noisy in the background, let me know, but I'll do my best. I'm Laura Duckworth. I'm the Director of Occupational Programs at the University of Virginia in Facilities Management. So I do not have a direct reporting structure to environmental health and safety at the University of Virginia. I do meet routinely with the director, Tom Leonard, and we have a standing meeting every couple of weeks to make sure that we're in alignment with what we're doing, and he knows. Just to give you an idea of why facilities management has their own group of occupational health and safety people, we have 1,200 facilities management employees that supports both the academic side as well as the healthcare system side. And that includes over 550 buildings, new and historic. And I'm sure everybody knows that UVA Central Grounds is a UNESCO World Heritage Site. And so we've got multiple skills and ranges. We do a lot of renovations and in-house construction. We do a lot of things ourselves. So we've got skilled trades from sheet metalists to historic masons to plumbers to, so it runs the whole gambit. We also use contractors as well. Very briefly, my history, I've been at the university for about 6 years. I came via George Mason University, where I was the Director of Occupational Health and Safety for the whole university up there. Prior to that, I was a biosafety officer at GlaxoSmithKline Pharmaceuticals, and there from North Carolina Department of Labor. I was with North Carolina OSHA for 10 years in multiple capacities there. So that's just a brief stint about me, and I'm excited to hear what everybody has to say and to hear what the questions are. And one of the things that I found to be most successful is the collaborations, because if somebody else has solved the problem, I want to use it, steal it, reimagine it. And so I'm excited about this. I really appreciate being asked to be involved. Thanks, Matt.
Absolutely. And let's hand it over to Melanie.
Hi, I'm Melanie. I'm from the University of Miami, and I work as a biosafety technician as well as compliance tech. And then I also have the role as the laser safety officer and the shipping of dangerous goods specialist. We are divided into 3 main campuses. We have our main campus, which is in Coral Gables. And then we have our medical campus, which is where the Office of Environmental Health and Safety is located, which is where my office is located, which we have around 12 buildings. We have 2 hospitals, including one of the top eye hospitals. And we have clinical, most of ours are clinical and research buildings. We have a few admin buildings. Our Marine and Atmospheric Sciences campus, which is amazing. If you're ever in Miami, look me up and I'll get you a tour of that place, which includes a ship, a couple of boats. We have a helicopter now. We have research buildings there, including it's famous on the Weather Channel, our hurricane simulator, which is this giant, sort of like a big tubing, a square tubing, and it simulates, they can create up to the storm surge of Category 5 hurricanes, which is really cool. My background is I've spent 12 years at the University of Miami, and I've gone from just starting off doing compliance up to where I am now. And we've had big changes within our departments with people leaving and some of our top management in EHS actually retiring. So we have got a new team in, our executive director. She's coming up to her first anniversary and she's made some great strides in our department. Before University of Miami, I had taken a gap year here in Miami, and before then I was a lab technician in the water and wastewater industry back home in New Zealand. It's me.
Great, thank you. And on to Ron.
Thank you, Matt. So my name's Ron Souza. I'm the Director of Environmental Health and Safety at the University of New England. UNE has 3 campuses. The 2 primary campuses are in Maine, on the southern part of Maine on the coast. And then we have a 3rd campus that's been open for 5 years now in Tangier, Morocco. I started my career back in 1976 working for EI DuPont. And then I moved on from there to Children's Hospital in Boston. Then I was working for a hazardous waste transporter doing consulting across most industries. And then I ended up here at University of New England. They were one of my clients and I knew they were a great place to work. So when an opening came available, I took that opportunity. We have about 150 employees that are in what we call our campus operations, and it incorporates the security, our facilities, and our housekeeping staff, and my department reports through that same structure. So I work with those folks daily, just trying to keep them safe. And we've been dealing with the COVID situation just like everybody else right from the beginning, trying to keep everyone safe at that point. So hopefully we can get to all of those answers today, right?
That's the hope. And if not, we'll see what we can do about distributing the questions and maybe crowdsourcing some of these to just pool the community here for their knowledge. Great, so we have some of these details about everybody's background up, and without any further ado, we can get started with our questions. And Ron, the first one is going to be for you. So I had a question for you about centralizing UNE's PPE purchasing. Has that made it easier or more difficult to procure some of the facility-specific items and equipment that you need, in addition to the other needs of the university?
Sure. So prior to the COVID virus, all of the purchasing, we have 6 colleges within the university system, and 3 of them are related to medical professions. We have a school of dental medicine, we have a college of pharmacy, we have a DO, which is a physician program. We have a college of health professions, which covers nursing, dental hygiene. So we have a lot of focus where the students are working with patients, direct care, hands-on type care. And that was a major concern. But the concern from my end was that with all of the budgets being handled independently, we had multiple suppliers, multiple vendors, varying degrees of availability of PPE like N95 respirators. Some of our vendors couldn't guarantee anything. Some could, but then they couldn't give us pricing. And then I was concerned on our end, we were going to have to fit test everybody. And I envisioned 6 to a dozen different styles and models of respirators. And it was going to become a nightmare when they ran out 2 months later, and then they purchased another brand and we'd have to fit test them again. So very quickly we got in front of right up to the president that, look, we need to get a handle on PPE, centralize the purchasing, and they agreed. And it basically has been running through my department since back in early March. So we've been able to identify vendors that could provide us, and our key focus was making sure that for the academic year, do we have a reliable supply? And then once we acquired that, then we worried about price. A good deal for a respirator at $4, but they can only get you 5,000 respirators. Our dental school would go through that in 2 weeks.
Wow.
And that wasn't going to work for us. So it was extremely important for us to secure a reliable supply that would get us through the academic year, at least from an N95 respirator standpoint. But it just kind of grew from there, surgical masks, gowns, face shields. So we've been doing all of that purchasing centrally through my department. And it's worked out very well. It's been manageable, and we just back charge the different colleges and departments based on what they take, because we know what each unit costs. So.
Great. And after each of these questions, if our other panelists would like to just weigh in quickly, kind of hearing these responses, if that brings up anything that you'd like to say, feel free. We'll just give a brief pause here for that, and then otherwise keep going.
We're doing the same thing, Ron, is facilities management is helping to distribute, but the university came together to realize that we would be competing with ourselves if we didn't do a central purchasing kind of thing. And so there was a task force that was formed so that we could distribute the PPE and try and make sure that it was being appropriately distributed. And in facilities management, we went through and collected actually all of our filtering face piece N95s and donated them to the hospital because it was critical for them to have it. And a lot of our filtering face pieces were voluntary use. If we were requiring the respirator use, it was a powered air purifying respirator or an elastomeric respirator. And so we were able to help early on offset the shortages for the hospital. And that was part of what was indicated as to why we should do this central procurement. So I think that's great. I think a lot of universities are going to do that.
Yeah, we did exactly the same thing. So.
Great. So Melanie, actually the next question I have here is for you. So sometimes, as we sort of discussed, just getting the proper equipment into the hands of those who need it is difficult. What strategies have you employed to make sure that anyone who needs something like community protective equipment or social protective equipment, masks as opposed to maybe PPE, actually gets it?
What we did is we did a survey on who had what, who needed what, and then worked out where the people were that needed what. So we at the beginning, we kind of found that people would have to, they couldn't get it from where they started the day at work. So we ended up working out that using, say, the security department in one building, like where the security desk was. And that's one place where they distributed it, or an admin building, but only in one location per building, or maybe two, depending on the size. And then what we did is when we got an idea of how many were needed, we worked out, okay, you're going to get a box a week, or you're going to get a box a day, or like 3 boxes a day, however was needed. It was allocated, and we kept a tally on that, and it was, and that's how we worked it out. And then people actually had to show their ID to say, hey, this is Melanie, I work in Dominion Tower, I need this. And then they got used to who was who in the building, and it got a bit easier for people to access. Mm. So. But as I say, it's a fluid situation, so we're moving as it goes. And once again, we're also having to prepare for hurricanes. So we've got to keep the supply in that people have got to work to prepare things. And if we've got an incoming one, we've got to have things available for our facilities to say, like, put up hurricane shutters. So it's that. We work out where it's needed, and as you say, it's a fluid situation. If we find that, okay, more people are starting to arrive back at work in this building, we're going to have to supply more. So that's how we did it.
Great. And next question is for you, Laura. So have you found that COVID safety needs compound the challenges of normal facilities and maintenance safety? Have you found any solutions yet that seem to address those issues that you've uncovered?
Thank you. So the thing that we've done is, so yes, I think we were kind of talking about it earlier, how people are so focused on social distancing and COVID and trying to make sure that they're not being exposed to the virus, that they aren't remembering that there are other hazards still present in their work environment. You know, using the nitrile gloves instead of cut-resistant gloves. That happened early on, where we were having a lot of hand injuries because they were so worried about touching stuff for the COVID and the fomite transmission that they weren't using the appropriate safety gloves that they needed. And so what we actually started doing was, my team puts out a monthly OHS safety minute just to update the FM community about what is going on and how things are changing. And we started doing a weekly edition and trying to figure out what are the hot topics, what are the safety committees seeing, and it became kind of a communication vehicle to make sure that people were having a venue to verbalize their issues, talk about their hazards. Our in-house construction crew, our renovations crew, actually assigned monitors to some of the job sites. So I'm not sure if it was everywhere, but in Virginia, construction was deemed an essential job function. And so construction never stopped. And so not only did we have our in-house construction and renovations crew, we had all of our general contractors and contractors working on grounds. At UVA, we call it grounds, not campus. So we had them working on grounds, and you know, the face coverings, especially as it becomes hotter, is becoming an issue. And I don't know if everybody's having that same issue. I imagine, Melanie, you have that all the time.
Oh yeah, that's an issue.
And
yeah.
So we actually started a discussion group that's every other week with the local Virginia Department of Health, with the local Virginia OSHA team, the consultants, as well as the compliance group, and probably 15 or 20 contractors. And we're all sharing best practices. The thing that I love about our region and the contractors and the partners that we have in the community is, even though they're all vying for the same jobs, they say when it comes to safety, it's not about competition. It's about all of us getting our people home at the end of the day and sharing best practices. And so that's how we're kind of trying to overcome this, is communication and education. And one of our biggest challenges is, I'm a huge advocate that training is the most important thing that a safety and health professional does, because if you don't train people and tell them what the expectations are around being safe, then how can you expect them to do that? And so all of our training was in person. Well, we don't do that anymore. So we've had, you know, lots of Zoom trainings, and we're partnering with our human resources group because they've got a learning management system online. Anyway, we're trying to continue to grow to meet our customers' needs in facilities, as well as improve efficiencies and have a continual improvement. My entire occupational health and safety team we have responsibilities around continual improvement. We're attempting to comply with ISO 45001 guidelines and document practices, and using all of these tools to try and make sure that we're there to provide the support that we can for facilities management people.
Great. Yeah, I know that that element of training and getting people invested in their own safety has been a real recurring theme across these webinars, and that when you're trying to actually get people to do these behaviors that you can't audit all the time, that's just what people have found to be a particularly effective strategy.
Absolutely. We're really lucky that the employees in facilities management at UVA are really passionate about safety and are huge advocates. And so, you know, my safety team is small and we support them wherever we can, but most of our employees now are more likely to go to each other. Those are the, you know, because they're their own subject matter experts with electrical or plumbing. And I don't want to say we're just safety professionals, but partnering and collaborating together is really what makes the difference, because then you get the subject matter expert and the safety expertise together. And I think that's how we're slowly overcoming it. We had a dip in our reporting for injuries and incidents. And so we're reminding people, hey, we want to know, get those near misses coming in because they're going to be different now.
Great.
So just trying to keep that line of communication open.
Yeah, absolutely. Going to jump ahead here to another question just to keep us moving. And before we do, A quick reminder to our attendees that you can go ahead and ask questions in the Q&A box through the Zoom webinar control panel. And there you can respond to each other's questions, thumbs up the ones you're interested in. We're going to have a very lively live Q&A after we ask a few more questions here, and we'd love to get bombarded with anything you have to ask us about. And next question here is going to be to Ron. I was wondering if your facilities teams are involved in disinfection protocols. Is that a branch of facilities, or is that something that's handled individually, or are there particular times where facilities may be handling disinfection, whereas generally your big employee base would be handling other smaller aspects of it?
Sure. So indirectly, they would be involved. So we actually have one building, one dormitory that we've set aside for when the students come back this fall. If a student is suspected that they have come down with the virus, this building is set up with, it's just suites for dorm rooms. So that student would have their own suite, and they would, in the event that they would need services like something wrong with the suite, plumbing, or then our facilities people would have to go in there. So indirectly they are part of that team, but our housekeepers, my department, and the facility staff are all on that team. So we've got all the different equipment. The housekeepers, we have 12 disinfectant fogging units, 8 on this campus, 4 in our Portland campus. It uses acetic acid and an electrolyte solution. So that's our primary method of disinfection in our common spaces right now. We've been doing that for over 2 months. And then for dormitory rooms, we would hit the rooms with that first. People would have appropriate PPE, so they would have a jumpsuit, N95 respirator, gloves, that type of equipment when they go in, whether it's a housekeeper or someone in my staff, EHS, or facilities.
Great. And Laura, same question there to you as well, if you'd like to chime in there.
So we actually do. We have a system where as soon as we find out about a potential positive case, our custodial team has a protocol that they put in place to, if at all possible, to isolate the space and leave it unoccupied for hopefully up to about 72 hours, so that we can certainly make sure everything has settled and then go in with a good cleaning versus disinfecting. We still go in and disinfect because it makes people feel better, because right now with this area of unsure times, it gives people that sense of security to know that it was used with those EPA approved disinfectants. But it's a very stringent protocol that, and we do have some of our custodians that have been fit tested for N95s. We went through the whole rigmarole and put them into our respiratory protection program, because if we've got sensitive areas like our systems control, which has to be occupied and monitored at all times, or our heat plant and things like that, if there is a potential positive or a person under investigation in that space, then we would do the quick turnaround time, and we would want to send them in with the utmost protective equipment that we could, even if it's a little bit on the conservative side. So yeah, we do, and we're working with our distributors to make sure that we have plenty of the appropriate disinfectants to use. And on the construction sites, interestingly enough, as we get notified of positive cases on construction sites, they actually have partnerships with companies that are coming in and using these fogging machines to disinfect construction sites so that the work can continue. And we have a very strict notification system and all of that sort of thing to try and work with the health department for notifications.
And our next question here is going to be over to Melanie. I was wondering if you could describe a situation in which social or temporal distancing is not available as an option to keep people apart. How do you manage safety in those locations where people just sort of need to be together?
Once again, we assess each situation. So we've got areas where take the suite for EHS also includes the employee health office, and we have a tiny itty bitty reception area. So what we've done is we've used the hallway for people to wait. We've also got areas where we've opened up other offices that were normal regular people's offices and made them lunchrooms for people, because we still have labs that are working through this. Either they're working on SARS-CoV-2 or they are essential research. So in those areas, we have each floor, if they've got people that are working there, essential research, we've opened up other offices and made them as lunchrooms. And we've done, as we do walkthroughs for different things, we keep an eye on that. We had people go through and either remove chairs, lock them away, and then put notes on, hey, you can only have so many people. But we can only police so much. We had issues outside. We noticed people were sitting outside having their lunch. In the end, we had to tape up chairs and things like that. So we just try and provide extra spaces so people aren't congregating. And our elevators, we've got the little spots where only 2 people can be in an elevator, which we actually have. It actually only applies to our medical campus. The city of Miami has a restriction, law, whatever it is, of how many people can be in an elevator at any time. They have their own, the city mayor put out a restriction on how many people, which is 4 at the most, depending on the size. So we had to do that as well. So we just assess each situation, find spaces that can be used instead of give people the option, give people an alternative so there is no reason for them to congregate.
So this elevators topic, I know, is a pretty hot button issue. Oh man, real concern for me as well here. Ron, Laura, do you all have elevator restrictions or particular guidelines or resources in the elevators, like disinfectant wipes or anything, for kind of trying to keep those spaces safe?
Yeah, so we have a restriction on the limited to a number, 2 people to the elevator. I can't recall how they were going to address it during move-in, but we've spread that out over 4 or 5 days to reduce the backup. And stairwells have been designated for move-in. Up, there's an up and a down stairwell. As far as our classrooms, 100%, all of our spaces, lecture halls, any academic space has been 100% mapped out. We've got photographs. They're going to be posted on the exterior of each room so that when someone enters the classroom, if students or someone decides to move things around, the rooms can be set back up the way they're supposed to be. We are a face covering required campus. So other than, I'm in my office right now, I don't have to wear my mask. As soon as I go out in the hallway, I have to put this on. If I'm walking across campus to another building, I'm supposed to have my face covering on. If I am working outside, so if I'm a groundskeeper, for example, and I'm actually performing a job function and I don't have a social distance issue, then I do not need to wear a face covering. We had plenty of discussion about, well, I'm walking from one building to the other and I'm working. I don't need to wear a mask and I'm by myself, but people at higher levels decided it would be easier to manage if it was clear that face coverings only. So on campus, that's how we're set up. Contractors visiting have to fill out a form questionnaire that asks a series of questions, and those are kept on file for any contractors or visitors on campus. And then in our clinical settings and laboratories, especially in the clinical settings, so we have a lot of instruction that needs to be done hands-on. In all of those clinical settings, they are going to be wearing N95 respirators with face shields and gowns. And in a good way, it would be a real world setting if, because all of our clinical rotation sites at hospitals are requiring students to bring their own PPE, which would include an N95 and a face shield. So we're setting the classrooms up to kind of mock what they're going to see in the real world this point forward.
Fantastic.
So that's how we're kind of handling the close, where you can't maintain the 6 feet.
Right. Great. And just quickly jumping over to Laura, got a couple minutes here for you to respond before we get on to a final round of questions before our live Q&A here.
So just briefly, we're actually posting signs for 1 person per elevator. And to be completely honest, I'm not sure how we're handling move-in. I'm sure that that is certainly being taken into consideration. And but where possible, 1 person per elevator with stairs. And then there's been a lot of discussion around unidirectional trafficking and trying to follow what the CDC guidelines are. And it's so hard to keep up with them because they seem to change almost minute by minute. And you think you're doing great and you make a statement and somebody goes, well, that's not the most recent thing on the CDC. And you're like, oh, okay, great. So it's, I think that's the thing. We're all just really trying to react, which is what's so frustrating, especially for me as a safety professional. You never want to be in that react phase. You always want to be in that proactive phase. And so it's really hard to do that and quash fears and everything. So anyway, we're trying to do 1 person per elevator. And then of course in the hospital and things, you make accommodation for healthcare workers to travel.
Fantastic. And then just one quick round the horn here, a question for all 3 of you. If you could keep your answers short so we have time for the other things. I'd love to hear just the 1 or 2 few things that are on your mind as big concerns for facilities safety going forward into the future. So Melanie, would you like to kick us off?
The big concern we have for us, or the big thing is when we have to do, I've brought it up a few times, when we have to do quick preparation, sort of like a hurricane, we find out that it's arriving in 3 days. Having to have everything ready, the accessibility of things, the access to things like PPE, and then how to deal with our students that want to fly home. We have a lot of international students from Central, South America, Latin America. So we're a very international university. So that's a big issue we have when students, because we close down campus. We try and get as many students as possible home. We encourage even the employees that don't have to be in South Florida to leave, head up to another place of the state, head up to Georgia or somewhere like that. That's our big thing, is having to react to other emergencies as well as having during this time of COVID or any other emergencies. Yeah.
Ron?
Could you repeat the question again?
Yeah, of course. Just wondering if in a few words you could share some of the things that you are kind of thinking about or most concerned about for the future of facility safety as we continue, into the summer and fall and future of the COVID world.
I think the biggest concern, and it's not just mine, it's shared by most of the employees, especially our faculty. It's the unknown at this point. What with the students returning, right in the last week or two, we just started bringing our graduate students back in. They were all asked to self-quarantine in the state for 14 days before they showed up for class. It was an honor system at that point, and I don't believe that that is going to happen when the undergraduates come back in. It's just, there's not that kind of space or any available location for them to quarantine for that period of time. So I think that's the biggest concern right now, is just unknown at what, you know, with people returning. We've got all kinds of things in place. But as anyone knows, as soon as you have a solution, there's going to be something that gets thrown at you that you're not prepared for. So we'll just try to have everything in place, following the best guidance out there, and in some cases, what makes sense, not necessarily the guidance that's out there. We're trying to do things that are practical as well. So,
yeah, no plan survives an encounter with the enemy.
Yep.
And Laura, any thoughts you had or concerns on sort of the future facilities maintenance here around COVID?
So one of the things that we've been trying to work with our employees around is, instead of adding masks or adding some of the accommodations to the way you currently do your work, is trying to get them to reimagine the way they do their work so that they can more effectively and safely social distance and wear their equipment, and, you know, be attentive to the heat stress as we go into the hot summer months and that sort of thing. So trying to realize that this isn't just something that's just going to go away, that this is here. And it's, you know, I was having a conversation with my father not too long ago, and he said, you know, they projected a vaccine for HIV was going to take 2 years. And here we are 20 plus years later, and we still don't have a vaccine. So let's be practical and try and reimagine the way we do work, instead of hoping for something that we all think is going to happen, but might not, or it might take a little bit longer. So reimagining the way we do our work for efficiencies and effectiveness could just be a positive thing.
I think I heard when you mentioned that vaccine delay, about 250 people here, knock on wood. Fingers crossed, but yeah, keeping those things in mind is really critical. And without further ado, we're going to transition over here to our live Q&A portion of the event. Just a quick reminder to all of our attendees, there's a Q&A functionality here in Zoom webinar where you can ask questions. There's a great discussion happening across a number of different topics already. You can respond to each other's answers, and you can also thumbs up the questions you're most interested in, so that way we know what we'd like to be addressing first. And we'll kick it off here with a question from Karen. Karen's wondering, what are the current PPE recommendations for staff who perform HVAC filter maintenance?
you want any of us to jump in?
Oh, yeah, feel free.
Okay. So our current procedure right now, everyone will, any of the HVAC on the filter maintenance, they'll be in a Hvac jumpsuit, gloves, N95 respirator. If they have facial hair, they're going to be wearing a PAPR. So that's how we're set up to handle it right now.
Laura, Melanie, I'm just gonna kind of assume here that you guys are on the same page, or
Yep.
like the, right. Great, sounds good. Next question here is for from Leanne. She's wondering, what is your protocol to clean a space after a positive COVID case has been identified to include what PPE do you have for your cleaning staff wear? And before we get into this one, I am just going to go ahead and show everybody our upcoming webinars. This is pretty relevant here, as we have one coming up in a few weeks all about coronavirus disinfection technologies and tactics. A new one here should be live on our site to review and sign up for, which is going to be on contact tracing strategies and execution. And our next one in just a few weeks will be all about face masks, community and social protective equipment, really diving deep and getting granular on those things. So hopefully we'll address this question again in a few weeks, but we can get to it now. So just to reiterate, because I talked for a little bit there, Leanne's wondering what your protocol is to clean the space after a positive COVID case has been identified, and to include what PPE do you have your cleaning staff wear when they are disinfecting?
I'm happy to start with that one.
Go ahead.
So it's kind of to reiterate what I said already is, if it's before 72 hours, we have them wear, actually, if it's within the first 24 hours, we have them wear a filtering face piece, a disposable N95, disposable gown, and gloves. And so they go in to protect themselves. If at all possible, we wait up to 72 hours or even longer if we can, so that the aerosols are settled, so that we can go in, and for all practical purposes, based on the evidence, the virus should be dead. So we can go in and do the disinfecting without a whole lot of risk to our employees.
All right, great. And up next, a question here from Amy, wondering what are the current recommendations for HVAC filter types, MERV3 or other? So anything changed there just with COVID happening?
Not my area of expertise, but I in discussions, I know our HVA technicians are looking at the different options. I think they were looking at MERV 13 filters, and I honestly don't know what a MERV 13 filter is because I'm not an HVAC guy, but it has something to do with pump fan efficiency or something. So
this is actually a part of the webinars that I really love. This is really about everybody having all the answers here, right? We really have a ton of people here, so feel free, everybody, to go in. If you have experience with HVAC, you have some experience with different types of filters, go ahead and you can start talking with Amy right there in the Q&A, answering that question, having some back and forth while we're going on to discuss other topics.
And so for us, it's the same thing. We actually are trying to get the MERV rating, the maximum MERV rating we can for the system in the building, because we've got different systems in all of our buildings, age and, fan speed and fan size and all of that. So we have a team actually working on our trades guys, as well as our engineers, mechanical engineers, working together to try and figure out which building can hold which MERV size filter without putting too big a strain, and trying to, again, still keep those building efficiencies and sustainability in mind.
And I know from previous webinars as well, there have definitely been some thoughts and concerns about what's going to happen when people come to campus, return to locations, start propping doors or windows open, changing all of those things as well.
They never do that.
And fantastic. Next question here from Thomas. Thomas said that he currently acquired a Clorox Total 360 fogging machine to assist custodial services with sanitation. And he's wondering if you had any experience with this equipment and if you feel it would be a good approach to disinfecting a campus at large.
So we have a
I don't.
We have, as I said, 12 fogging machines. It just uses a different disinfectant, but I think it, from an efficiency standpoint, it works very well. They come in our office and fog every night, and we don't have any evidence of it. There's no extra wipe down or cleaning that's required. We are hitting all of our public spaces, lobbies, restrooms 3 times a day with the fogging disinfectant. So it's been able to help us disinfect at a level that we couldn't do with, and we haven't had to add any additional staff, which is a plus. So that most of these pieces of equipment have all the data to support what it kills and what the kill time is, and I think it's just a question of what instrument you pick to do, but they all seem to work.
Great. Jumping on down here, I have a question from Howard. What are your guidelines for social distancing for facilities people who have to work in close proximity with each other? We touched on this a little bit earlier with this topic of, these tight enclosed spaces. And Melanie, do you have any thoughts there for when you just really can't put 2 people farther than 6 feet away or have to keep them closer?
Our recommendation is just general good hygiene with people. We try to train the person first and then add the PPE. So we try to see if a job can be done with only one person, but if not, just to be as best hygiene as they can. That's all we can do. There's nothing we can put really in place to do so. I mean, I know personally for myself, and sometimes I have to do the fit testing. We're in a small room, so wearing the glove, making sure we don't, being very careful what we touch. You don't touch, wipe down when you can. Yeah, just the general hygiene. I mean, that's all we can do. Make sure we're wearing some sort of mask, and actually in our medical campus, you have to wear a surgical mask. Mm-hmm. Unless you're sitting at your desk, but going to get a glass of water from the fridge, yeah, you have to wear it. So that's across the board on our medical campus. And also it's a city mandate that you have to have face covering at all times. So you just do what you can. And as I say, just good hygiene.
All right, great. We have a question here from Stephen. Stephen was wondering if you are flushing building water supply systems and conducting any testing to decrease the likelihood of Legionella growth and potential exposure. And I know from a little bit farther down, Stephen also wanted to clarify that question by saying these are buildings that have been left alone for a while, you know, probably during the early stages of COVID emergence when everybody just vacated very suddenly.
So short answer, yes, we are.
Yeah.
We're going through it. We've identified all those sources that have been shut down, dorm rooms in particular, water fountains, everything like that. And we are going through the process as we bring the school back online. Things are being flushed and then tested.
We're doing the same as well. We actually just started the process in the dorms. We actually have a brand new dorm that's opening this fall, so that makes things a lot easier in the whole dorm sense, because we're demolishing once, we don't have to do that. So yeah, we're doing the same. We just started, I think it was last week, with the testing, flushing and testing.
Well, it looks like it started storming over where Laura is, so we have to say goodbye to her a little bit early. But I'm sure she would be here if she couldn't. Hopefully gets inside of that, just the Bittman house a little bit sooner than she had expected otherwise. So just to build off of that quickly, I know that it's a big concern here is testing eye wash stations and safety showers if you're in a laboratory environment, especially those tend to sit alone for very long periods of time anyway, but particularly as people are coming back, making sure that your laboratories are equipped with ways of auditing their own stations, making sure that those have been tested just to avoid anything slipping through the cracks. Very important there, as especially for, you know, those places where it's going to be contacting mucous membranes.
We've actually just started improving our program of just before the COVID hit, of the emergency shower and eye wash stations. We had someone go through, walk the entire campus and state the location of the eye wash stations and showers. And we actually installed a few. So we're actually going through and checking them. We've got the little sticker signing them off because we've started our lab inspections, the safety inspections as we can. And they're being done then. We're encouraging people to check them weekly, which is the normal thing for eye wash stations. Our facilities goes around once a month, they will check the showers. So we're kind of already in that process of doing that because we've just revamped our eye wash and emergency shower program. So we're sort of already in place before COVID hit, so yeah.
Great, and next question here, scrolling down to, looks like Leanne had another question here. How are you going to handle fire drills in your facilities since that may require folks to reduce their social distancing while exiting the facility? Have you changed your fire drill plans or fire evacuation plans at all to accommodate these situations, especially with these like very frequently crowded stairwells?
I'm not sure on that one. That's, as I say, not my area of expertise. Our fire safety manager works with that along with the city. So we actually just had the City of Coral Gables, which is where our main campus is, has just been doing the fire inspections. So I'm sure that's an area, but as I say, that's not my area of expertise, and it's actually got me curious to find out what that's going to be. So I'm going to check that tomorrow when I'm in the office.
We have not discussed that directly, but since we are a face covering required campus and the contact time is minimal, I don't anticipate that it would be any increased risk, but that'd be a good topic for discussion. So thank you for that question.
Sounds like that's still a very active one, so I'm just going to leave that one unanswered, and that way everybody should still be able to respond if they'd like to discuss that one some more. Looking a little bit farther down, Lacia here had a question about engineering controls in bathrooms. So this is, I know, a very hot button issue for some people. She was wondering if there are any engineering controls or other methods in place for shared restrooms where air insulation and toilet plumes may be a concern for flushing toilets, and also concerns about forced air hand dryers and whether those have been shut down or taped off in some way. And just generally looking at concerns in bathrooms as places of transmission.
We had already.
Go ahead, Melanie.
We'd already we're phasing in getting rid of the hand dryers, and some of our bathrooms have been locked off, but if people need them, they've closed up, say, the middle stall, so there's like a gap between each door, and that's what most have been done, that we've done. But as more people are coming onto campus, that's something that we're addressing.
So we're having active discussion right now about the toilets. We have not come up with any solutions to that, and the hand dryers are not an issue because we don't have any powered hand. We have hands-free paper towel dispensing, so it's not an issue from that point. But yeah, definitely the flushing toilets and urinals are definitely an issue that we're still trying to address.
I would also recommend for anybody who's interested, I believe at the Q&A portion at the end of our last webinar on safety culture, John Klein spoke briefly about an experience setting up a protocol for bathrooms, and I think that may have been touched on by our other panelists as well. That actually may have been during the webinar itself. I'm going to just revise that and say not during the end Q&A, so just something to check out if you're interested in learning more about these topics. And here's another question, very topical for the summer right now, from Troylin, asking about handling the safety of workers that are required to wear face coverings outside, even though temps are very high. They're apparently in New Mexico, where it is over 100 degrees Fahrenheit right now, which sounds just miserable.
Yes, I saw that question. I was going, oh, if I don't answer it this, I'm going to reply. And this is the issue we have because not quite although we have had some. Last week we were in the hundreds, and then we have the humidity added onto it as well, which makes it, you're sweating like crazy. What we have done is try to shorten their times that they're doing the work outside. Make sure there's an AC room available, there's the Powerade available, or whatever is there. And we've noticed that there's been a lot of hot work permits being put through. So once again, that's our fire safety, life safety person. So I'm not a complete expert on that. So I'm going to actually, that's another one I'm going to write down. And yeah, I know we limit the work to the mornings, or not so much the afternoons, because we always get our big rainstorms and thunderstorms, which, so I know the shifts have changed a little bit and when the work gets done. So, but once again, that's not completely my area of expertise, but that's just what I've seen be happening at UN.
So back in mid-March, we, all of our facilities, including grounds, switched. We split the shifts to, which immediately cut the possibility of contact down in half. So we have people starting earlier and other people coming in later. It's not really a second shift, but it's, so we've split the shifts. We've increased or actually emphasized making sure that preventive maintenance is done timely so that we avoid emergency repairs that require 2 or more people to handle tasks. So far, everything's been working. We haven't had any situations where we've had to put more than one person on a particular job or task, especially outside, but it works on the inside work as well. Boiler rooms, mechanical rooms where temperatures can be hot even in the winter. So that's how we've handled it so far, and it seems to be working. So.
And with that, we are at our 4 p.m. mark here for when our webinar is scheduled to end. We do have many more questions, so if either of our panelists, you two, are able to stay on for an extra 15 minutes to address these, that would be fantastic. But also, of course, this was the time we had, so I just want to say a big thank you before everybody goes to everybody, including Laura, who had to depart after the heavens apparently opened up on her. And thank you for your time. And just going to have a quick check in here to see if you two will be able to stay on for a little bit extra to address some of these remaining questions.
I can stay on a little longer, yes.
I can too.
All right, fantastic. Going on here to, let me just scroll through there. You guys are definitely chatty today. This is great. Also, Melanie, Ron, feel free to look through the Q&A portion, and if there are any questions that stand out to you as particularly interesting, you can highlight those as well. Here's one from James asking if waivers should be used in connection with facilities maintenance.
So I'm assuming he's talking about liability waivers, or maybe not. But I mean, the only thing we're having anyone sign is it's a COVID-19 form that they fill out that it asks about a half a dozen questions. The typical questions: have you visited anywhere? Are you been exposed to anyone? Are you feeling well today? Those types of things. And those forms are completed and handed in at the start of the job or the day. We are checking temperatures in our dental school and our dental hygiene school because we have patients that are coming in, which means, and these are open clinics, so that you could have people coming that are from the public. And so we're checking temperatures and actively checking temperatures in those types of situations. But other than that, for visitors and contractors, they're just filling out the form that declares that they're not sick and they haven't been exposed to anyone that is sick and they haven't traveled, that type of thing. So I'm not sure if that's what he was looking for, but we have waivers for activities on campus, for camps and sports, use of sports equipment, but that's a different type of waiver, I think.
So here's another question from Romina asking about eye protection as part of the PPE suite that sometimes gets assigned for folks to wear. Is this something that you are assigning for your facilities and maintenance personnel to use generally in particular situations? Not at all?
So we're not doing anything exceptional in regards to eye protection. although I'll publicly recognize that you've got mucosal tissue in the eyes, and it is a potential source of exposure. But with, everyone on campus is wearing a face covering. In the clinical situations, they're wearing face shields. And then if any of our facilities people are going into those areas, they would put the same PPE on. But it would be very limited situations where they'd actually be in those areas where people are required to wear face shields. They should have their safety glasses on anyways for a good part of what they're doing. So even groundskeepers, they have safety glasses that are sunglasses. So.
And then just, because I forgot to do this earlier, I'm going to launch a quick poll here to gauge interest in upcoming topics and panelist interest. These are the community connection webinars. We try to pull resources from you, our community, to help keep these going in terms of identifying what topics you're most interested in, and also finding people who would be interested in participating as panelists here. We'd love to hear your responses, so I will keep that up for everybody to fill out as we address our next questions. Before I go on, Melanie, did you have anything you wanted to add to that question about eyewear as PPE?
Ron pretty much said what I was going to say. It's the same thing. It's they're going into an area such as clinical. They'll put on the face shield, the glasses, but we haven't done anything exceptionally different when it comes to safety eyewear.
Right. Well, great. We have a question here from Nancy asking if you allow face shields in place of other face coverings, and if so, under what circumstances?
No, we don't.
So we had up until Tuesday, we were only allowing face shields if an individual, an employee, or a student had a medical condition that warranted it. So they would have to either see the student disabilities department or go to human resources and apply for a variance to wear a face shield in lieu of a face covering. But our governor changed the executive order on Tuesday to include face shields by name. It didn't, because the previous executive order said face coverings or similar, which was pretty vague. But the wording in Tuesday said face shields as well. So we are going to allow them. Professionally, I don't think they do the same job. Not that a face cloth is much better, but so yes, we just started approving those.
Yeah, we haven't, we don't allow the substitution unless there's a very good reason why. And we actually did emergency management gave out little back to work bags that had a face shield and gloves and wipes and things like that, which was we found a really good idea. I mean, I was already in the office going on campus, already had everything. But that was a great idea that emergency management did.
Great. There's another question here asking about measuring the effectiveness. This is by Peter. Measuring the effectiveness of policy or procedures that you implement to ensure that they provide the safest environments for everyone.
Related to COVID-19?
You know, he didn't mention, but I would kind of imagine that, yeah, generally the question here is, you've got these new policies and procedures in place. How do you actually measure how effective they are at changing behaviors or awareness?
So it's kind of early at this point for us because we just had some students coming back. But that being said, we've already noticed a couple students that aren't wearing them when they're outside. even though that's what the policy is supposed to be. There is still discussion going on how it's going to be enforced. We recognize that that's going to be a challenge.
We just had a town meeting with our with some of our executive maybe last week, and they're having on our as the students come back, they're having I think they're called medical ambassadors, and kind of like, don't want to say the police, but they see someone, they've got information to give to people while on campus. So we don't have anyone on our, or any of the undergrads or anyone coming back. We have our sports team, so it's having a soft sort of reopening with how to test them and with our football team. So that's, see how that goes. And then, yeah, once again, it's a fluid situation. So on our medical campus, we don't tend to have an issue. One, because most of them are doing medical research or clinical, so they understand. So it's going to be interesting to see how things develop.
Fantastic. And next question here is from Carol, asking what others are doing to control the flow of pedestrians in and out of buildings, including but not limited to residence halls. Is this something that is concerning for you? Is it an issue for some places that are buildings that may be a little more open than others?
Could you repeat that again? I missed the first, it kind of broke up on the first part of that.
Yeah, of course. Carol's wondering what are others doing to control the flow of pedestrians in and out of buildings?
So
We have,
go ahead, Melanie.
we have designated entrances and then exits, and well, that's what we're starting off with, and we're going to see how that works and if we need to make changes there.
So what we're doing, the way that it's supposed to work, students do not need to wear their face coverings when they're in their dorm rooms, but when they hit the hallway, they're supposed to be wearing their face coverings, and we have some of our buildings have designated entrances and exits, but there's some that they're just not going to work for one reason or another. So it's not, in certain buildings, we do have designated entrances and exits, with the understanding, of course, if there's an emergency, any exit will work. But it's really relying on people following the face covering rule. Once you leave your private space, you have a face covering on, and the RAs and residential staff are supposed to monitor congregating in common areas, even with people masked. So it's really going to depend on how they monitor that, I guess.
All right, just looking through a little here to see if we can get one more question before we are done. And it looks like Angelica is wondering if anyone has performed any sampling for COVID, either air or surface, and said that she attended one webinar that offered analysis and went over the sampling method. Maybe that, oh, sorry, that was a other question by Angela that I meant to ask here. So Angela was wondering, or Angelica, my apologies, was wondering if anybody has performed surface sampling to validate the effectiveness of cleaning.
We are not currently, and right now we're not planning to, no.
Same here at this stage.
All right, and great. With that, we are at the end of our webinar here. So huge thank you to our panelists for lending their time and expertise here. And thank you to all of our attendees for showing up, asking these great questions, and having such a great conversation really appreciate everybody joining us this time. We'd love to have you on for our future webinars. Coming up next, we've got one talking about face masks. After that, one focused on disinfection technologies and tactics, and then one here about contact tracing strategies and executions. We really hope to keep these going, so we'd love to have you on as a panelist. If you're interested, feel free to reach out to me. My email is matt.siegel@bioraft.com. You can find that on our webinar homepage. And again, a big thank you to our panelists for joining us, and I hope you all have a great day and great weekend.